Hello everyone, thank you for joining us today. In today's presentation, Michelle, Daniel, and I will be discussing nursing terminologies, classification systems, and other terminology used in clinical practice. Today's presentation will focus on the following objectives: discuss the history of nursing terminologies and other classification systems used in clinical practice, look into the history and governance of NANDA, MEDRA, ICD-10-0, NIC, and NOC, discuss the purpose and function of NANDA, MEDRA, ICD-10-0, NIC, and NOC, and examine the structure and components of NANDA, MEDRA, ICD-10-0, NIC, and NOC.
Nursing terminologies. History. The nursing field is the largest professional group in the United States and many other countries around the world. Formal nursing terminologies began in the 1970s with the advent of computers to support clinical care. The creation of nursing terminologies and the domain of nursing informatics began because medical terminologies cannot describe the most comprehensive clinical concepts of the nursing profession. The American Nursing Association started to evaluate and identify nursing languages in 1991. Today, the ANA recognizes 12 nursing terminologies as appropriate for clinical practice and are used in certified EHRs. These codes are ABC codes, Clinical Care Classification, International Classification for Nursing Practice, LOINC, NANDA, Nursing Interventions Classification, Nursing Management Minimum Dataset, Nursing Minimum Dataset, Nursing Outcomes Classification, Omaha System, Perioperative Nursing Dataset, and SNOMED CT.
NANDA International History and Governance. NANDA stands for North American Nursing Diagnosis Association. NANDA is a nursing diagnosis that describes patient responses to disease rather than grouping diseases and disorders similar in nature. The timeline on the slide is an example of the nursing profession establishing a professional and official method of monitoring and implementing the use of nursing terminologies. The first national conference to name and classify nursing diagnosis was held in St. Louis, Missouri in 1973. NANDA was officially founded in 1982. NANDA became NANDA International in 2002 due to the use of the terminology in several countries outside of North America. Diagnosis submission and approval process for NANDA takes place over a 2-year cycle. Members of NANDA develop new diagnoses and submit diagnosis to NANDA's Diagnosis Development Committee, which is followed by a membership vote. Approved diagnoses can be found in the current version of NANDA's book titled International Nursing Diagnosis, Definition and Classification. NANDA International Purpose and Function. NANDA was the first nursing standardized language recognized by American Nursing Association. As stated on NANDA International site, NANDA exists to develop, refine, and promote terminology that accurately reflects nurses' clinical judgments. In addition to providing terms to describe nursing judgments, the terms also describe treatment and nursing-sensitive patient outcomes. NANDA is the foundation of nursing care planning and is used in numerous of nursing textbooks. The National Library of Medicine has included NANDA in its Unified Medical Language System. It is also registered in Health Level 7 and mapped into SNOMED CT. NANDA works in conjunction with NIC and NOC to provide coverage for the nursing care process and plans. NANDA International Structure and Components. NANDA is organized into 13 domains, which are health promotion, nutrition, elimination exchange, activity and rest, perception cognition, self-perception, role relationship, sexuality, coping stress tolerance, life principles, safety protection, comfort, and growth and development. Each domain consists of two or more classes. For example, classes listed in the self-perception domain include self-concept, self-esteem, and body image. Diagnoses are grouped into the classes. The code structure is for nursing diagnosis only. Codes are made up of 5 digits that carry no meaning. The organization of nursing diagnosis have progressed from alphabetical listing to a multi-axis taxonomy.
Nursing interventions classification and nursing outcomes classification, history and governance. The nursing interventions, NIC, and the nursing outcomes, NOC, are two classification systems that work hand in hand. They were developed and are maintained by a research team at the University of Iowa. These are two classification systems that are meant to be used in all healthcare settings for the treatment of all patient types. The research team holds annual conference where they take input for updates with publishing of new revisions happening every 4 years. Nursing interventions classification and nursing outcomes classification, purpose and function. The NRC standardizes the classifications for interventions performed by nurses, and the NOC is used to measure the effectiveness of those interventions. Nurses can use these two classifications in patient care and management. Some of the functions these classifications aid in include clinical documentation, communication, productivity measurement, competency evaluation, research, and nursing education. Nursing interventions classification and nursing outcomes classification, structure and components. The NIC is made up of 554 nursing interventions spread across 7 domains. The domains that make up NIC are physiological basic, physiological complex, behavioral, safety, family, health system, and community. The NOC contains 490 outcomes that use a 5-point Likert scale to measure the effectiveness of the interventions. The domains that make up the NOC are functional health, physiological health, psychological health, health knowledge and behavior, perceived health, family health, and community health.
Introduction to other terminology and classification systems. According to Giangelo, changes in the healthcare system have occurred within the past 20 years, noting gaps in the current systems. The movement towards EHRs has resulted in the emergence of new technologies and classification systems. The purpose of the WHO family of international classifications is to promote appropriate selection of classifications in the range of settings in the health field across the world. In addition, this is derived classification based on a reference classification, example ICD, oncology, and MEDRA. Related classification refers to a reference classification or associated at specific levels or structure. Since it was first published in 1976, the International Classification of Disease for Oncology, ICD-O, has been internationally recognized as the definitive classification of neoplasms. It is used by cancer registries throughout the world to record incidence of malignancy and survival rates. And the data produced are used to inform cancer control, research activity, treatment planning, and health economics. WHO published the first edition in 1976 of ICD-O. The second edition collaborated between the WHO and the International Agency for Research and Cancer, IARC, in 1990, and the third developed in 2000 by the IARC and the WHO. The purpose and function of ICD-10-O. used principally in tumor or cancer registries for coding the site, topography, and the histology, morphology of neoplasms, usually obtained from pathology reports. So the purpose of ICDO is to provide greater specificity for use by cancer registries and in pathology and other departments specializing in cancer. The topography code describes the site of origin of the neoplasm. The morphology code describes the characteristics of the tumor itself, including cell type and biologic activity. The structure and components consist of the following main sections. Number 1, instructions for use. Pretty much just instructions, contains guidelines needed to assign codes correctly. Number 2, topography, numerical list. It spans from C00-0, .0 to C80.9. The decimal point separates the subdivisions of 3 character categories. On the top right, there's a yellow square that has an example of the structure of the way it looks of the topography code. The example C50-.2 is for breast cancer. It tells you the 50 is the breast, that's the site, and then the .2 is showing where exactly is that cancer at, the upper inner quadrant, the subsite. Okay, back to the list. Number 3, morphology, numerical list. It ranges from M-8000/0 to M-9989/3. Now the first 4 digits give the histology, and the 5th after the slash is the behavior code. On the top right, again, is the square showing you the structure of what the morphology code looks like. M-8140/31. Well, the first 4 digits, the 8140, is the adeno tumor cell type. And then you've got the behavior, which is the number 3. It tells you it's carcinoma. And then number 4, the 1 shows the differentiation. Now on the bottom of those squares is the list of code and diseases, and it tells you what exactly those behaviors are, what their meaning is. So /0 equals benign, /1 uncertain whether benign, and then so forth. On the list itself, number 4, alphabetical index, is just uses to find both topography and morphology codes. And then the last, number 5, the difference in morphology codes between 2nd and 3rd editions. Well, what are those? What are the differences in morphology codes? They provide the new ICDO codes, new morphology terms and synonyms, terms that change the morphology codes, terms that change from tumor-like lesions to neoplasms, terms deleted from the ICDO-3, and terms that change behavior codes.
MEDRA, History and Governance. Developed by the International Conference on Harmonization of Technical Requirements for Registration of Pharmaceuticals for Human Use in the late 1990s, MEDRA is the standard terminology used for facilitating the sharing of information regarding medical products for regulatory purposes. The United Kingdom Terminology for Medicines and Healthcare Products Regulatory Agency was the product that influenced the development of MEDRA. The International Federation of Pharmaceutical Manufacturers and Association currently owns MEDRA. The organization MEDRA Maintenance and Support Service Organization updates the dictionary terms twice a year and is tasked with the maintenance, development, and distribution of MEDRA subscriptions. The ICH MEDRA Management Committee is responsible for the direction of MEDRA and supervise activities of the ICH MEDRA Maintenance and Support Service Organization. The medical terminology has been translated into several languages, which include Spanish, Dutch, Portuguese, and Japanese. MEDRA Purpose and Function. MEDRA was developed as a tool to manage clinical information about pharmaceuticals, biologics, vaccines, and drug-device combinations that are used by drug regulators and pharmaceutical companies. MedDRA structure and components. MedDRA is a multiple axle system consists of non-indexed codes. Codes are composed of 8 digits with no taxonomic meaning. MedDRA is organized into a 5-level hierarchy. The levels of structural hierarchy from highest to lowest are System Organ Class, SOC, High Level Group Term, HLGT, High Level Term, HLT, Preferred Term, PT, and Lowest Level Term, LLT. MedDRA hierarchical structure is built in which LLT terms are mapped to PT terms, PT terms are mapped to HLT terms, HLT terms are mapped to HLGT terms, and HLGT terms are mapped to SOC terms. As stated by Giangelo, the SOC level is the broadest concept in the hierarchy, which is comprised of groupings by etiology, manifestation site, and purpose. The HLGT and HLT levels group related terms by anatomy, pathology, physiology, etiology, or function. The PT level contains distinct descriptors representing a single medical concept, which includes symptoms, signs, diseases, diagnosis, therapeutic indication, investigation, surgical procedures, and medical family characteristics. And the LL level contains synonyms, quasi-synonyms, or lexical variants of the PT to which they are linked as stated before. Here is our reference slide. Thank you for joining us today, and I hope you enjoy our presentation.